So as Beth said, my name is Emily, and I'm the Community Engagement Core Lead of our Chair C grant. And I'm really excited to talk to you today about some of the work that our team has been doing. And I'm hoping that it may help to stimulate some ideas that might be useful to you in your work. All right, so today I'll start with a brief overview of the Chair C grant and talk about why it focuses on the intersection of climate change and older adult health. And then we'll take a closer look at community engaged research, and I'll share some examples of what that could look like in practice. And then I'll present some of what we've been up to on the Chair C grant, and we'll walk you through a few community priorities that our partners have identified and explore how we might address these through research. And then finally, I'll wrap up by sharing some resources that are available to support you and your work. All right, so first I want to orient you all to the grant that this work falls under. So Chair C, or the Center on Heat, Health, and Aging Innovation and Research Solutions for Communities, is a 3-year grant funded by the National Institute on Aging. It aims to study the impacts of extreme temperature and humidity on health, to advance community engaged science, and to develop actionable solutions to promote healthy aging in Rhode Island communities. Chair C is made up of 4 interconnected cores. There's the Community Engagement Core, which I lead, the Administrative Core, which Teresa Shireman leads, the Capacity Building Core, which Beth Fussell leads, and then the Research Project Core, which Alan Just leads. So as I mentioned on the last slide, the Chair C grant focuses specifically on the impact of extreme heat and humidity on the health of older adults. This topic emerged from conversations with the Rhode Island Department of Health, the Rhode Island Office of Healthy Aging, and community organizations when we were preparing this grant. So together, we really identified that extreme heat was a particularly important public health challenge. On this and the next slides, we've got some great graphics from the Department of Health that illustrate some concerns regarding extreme heat. But for some background, the National Weather Service puts out heat advisories when it feels like 95 to 99 degrees for 2 days in a row, or 100 to 104 degrees for 1 day. And this extreme heat can be really dangerous and pose serious health risks, especially for people who don't have air conditioning, people living in urban heat islands, or anyone who's vulnerable to extreme heat. In Rhode Island, we're seeing an increase in both the number and intensity of heat waves, and projections show that by 2050, the number of heat wave days in Rhode Island is expected to quadruple, rising from 10 days annually to about 40. And then while we're seeing more heat waves, the average temperature across the state is also continuing to rise. So then the increasing frequency and intensity of extreme heat events are especially concerning for vulnerable populations like older adults, young children, individuals with disabilities, and those who take certain meds that impair the body's ability to regulate temperature. Extreme heat also leads to serious health impacts like heat exhaustion, heat stroke, worsening cardiovascular and respiratory conditions. And during heat waves, emergency room visits and hospitalizations for heat-related illnesses, as you could imagine, are significantly higher. And then in severe cases like heat stroke, urgent medical intervention is needed to bring body temperature back to safe levels. And without it, this can really be life-threatening. So in addition to Chair C's focus on extreme heat, our Community Engagement Core has a little bit more of a broad focus based on the diverse priorities and areas of interest of our community partners. There are many other ways that extreme weather and climate change can impact health and communities beyond just extreme temperature, and some of which are depicted on the graphs on this screen. For example, climate change is worsening allergens and air pollution, which can trigger asthma, allergies, and other respiratory illnesses. And this is especially important in Rhode Island, where asthma rates are already particularly high. We're also seeing more frequent heavy rainstorms and flooding, which can damage homes and buildings. And in fact, Rhode Island has seen the nation's largest increase in extreme precipitation events in recent years. And water damage can lead to mold growth, increased risk of waterborne diseases, etc. So just a smattering of examples of the ways that our changing climate can impact health. Okay, sorry, just taking a sip. I have like too many beverages up here. All right, so I've gone over why climate change is a public health concern broadly, but now I just want to cover a little bit about why focusing on extreme temperature and other aspects of climate change are especially important for older adults. So as of 2020, 1 in 6 Americans was over the age of 65. This number is expected to continue to grow and grow faster than the population as a whole. And older adults are more vulnerable to the health impacts of climate change than the general population due to a combination of factors, including higher rates of chronic conditions, medication use, mobility limitations, and social isolation. So for example, during extreme weather events, older adults might lose power and access to essential medical equipment that depends on electricity, or they might lose access to services like dialysis. And for older adults who are living alone or with mobility limitations, evacuating during a weather emergency can be difficult or impossible. Additionally, cognitive impairments may limit a person's ability to recognize or communicate their discomfort, which may make timely intervention more difficult. And then older adults also have more limited access to resources to mitigate the impacts of climate change on health. And then these challenges are compounded by broader health disparities. Okay, this slide unfortunately presents some more troubling information about climate and extreme weather events and aging more broadly. Globally, older adult deaths from extreme heat have risen over 50% since 2000, and more than 80% of annual heat-related deaths in the US are people age 60 and older. Older adults also bear the brunt of the risk of death during extreme weather events. 75% of deaths from Hurricane Katrina, 63% of deaths from Buffalo winter storm of 2022, 85% of deaths during California wildfires several years ago were all among older adults. And this is just a few examples from recent extreme weather events. And so these risks highlight how important it is to plan for the unique needs of older adults in our climate resilience efforts. Okay, all of this is especially important when we look at what's happening in Rhode Island. So Rhode Island is considered a super aging state, which means that more than 20% of our population is over age 65, and this is growing. And so this means that as we continue to experience extreme heat and other climate concerns, a growing portion of our population is at high risk of serious or life-threatening health impacts. And so this really necessitates that we focus on how to quickly develop and produce policies and interventions that can help to address these issues. So I imagine that many of you are familiar with this finding from a few years ago that on average, it takes 17 years for research evidence to be translated into routine clinical practice. This number is often used to demonstrate the value of implementation science, and community engagement is a really critical component of successful implementation. And so when you work with communities that your research is intended to benefit, your research is more likely to ask the right questions to address community needs. It is also more likely to collect the data that can actually answer those questions, and then also setting up solutions that then the community members can actually implement. So sort of why focus on community engagement research? All right, so as I've said, I lead the Community Engagement Corps, and obviously that means I'm pretty passionate about the value of community engaged research. Community engagement research supports the idea that people should not only be involved in the decisions that affect their lives, but also in the development and interpretation of information that guides those decisions. It recognizes that communities harbor a wealth of information about their own experiences and perspectives that can positively inform and shape research, making it more grounded, relevant, and impactful. And so rather than viewing communities as the subject of research, community-engaged research sees them as partners whose strengths and expertise are essential to the research process. Community-engaged research is important for both researchers and communities. The thought is that when communities are meaningfully involved, it ensures that the work being done is relevant to their needs and thus more likely to result in actionable solutions and real-world change. It also helps ensure that research findings are more accessible. So rather than remaining in an academic journal and written in language that isn't lay friendly. And then finally, I think that community engagement research is really valuable because it helps to build trust in research and science and helps people understand more about the research process. Okay. So now I'd like to shift and talk about some community engagement frameworks. So it can be really helpful to structure your community engaged research within an established framework, of which there are many. Two popular and long-standing ones are shown on this slide. There's Arnstein's ladder of citizen participation on the left and the public participation spectrum on the right. And these frameworks can help to define how communities are involved and can support you in assessing where and how to improve your own community engagement efforts. The different levels of engagement they propose often include descriptions of what engagement can look like at that level, which can help you stay accountable and to keep in mind power dynamics and help you to track your progress over time. And then finally, I think that these frameworks can also help facilitate and provide structure for earlier and more meaningful engagement, which can foster longer lasting relationships and longer term collaboration and not just one-off projects. And then I'll go into more detail in the next few slides about how we put one of these frameworks into practice in our Chair C Community Engagement Core. Okay, so on this slide, we've got the framework that we orient all of our Chair C Community Engagement Core activities and thinking within. It's called the Spectrum of Community Engagement to Ownership, and it builds on the two frameworks that were on the previous slide. We picked this framework for a couple of reasons. So first, it was piloted among community-centered racial equity and environmental justice groups, including one of our community engagement core partners, the Racial and Environmental Justice Committee, or REJC. Also, the stated mission of this spectrum, which just brought up, is the key to closing equity gaps and resolving climate vulnerability is direct participation by impacted communities in the development and implementation of solutions and policy decisions that directly impact them. So we thought that this statement was like exactly aligning with what we hope to accomplish in our community engagement core. And then additionally, by framing our efforts within this spectrum, again, we want to shift from these one-off, like project-focused, specific engagements to like this ongoing sustainable engagement. And so we hope that by advancing our efforts along this spectrum, we'll become better partners and facilitate our community members to have more trust in us. One of the primary focuses and benefits of this spectrum is it allows us to assess or measure how we're doing with community engagement. So while designing Chair C and our community engagement core, we wanted a way for our community partners to grade our engagement efforts. So among the evaluation activities that we do with the community engagement core, once a year, we ask all of our partners to each individually evaluate where we fall on the spectrum and ask for feedback about how we can progress. And then we are recording and tracking this and sort of seeing how we're hopefully advancing over time. Okay, so I'd like to provide some examples of what the different levels of the spectrum of community engagement to ownership could look like in research. So I want to start by saying that we recognize that not all research can or should be fully community owned. It should be on that like defer to column. There are benefits and challenges associated with being at any point along the spectrum and at any level of community engagement. All right, I've got a lot of talking on this slide. Take another sip. All right, so at the lowest level of engagement on the spectrum, we have this inform, where communities are provided with relevant information. So this could look like giving a public presentation or a fact sheet of your research findings. This approach can be really useful if you're disseminating information if you need to disseminate information to the community quickly and cheaply, which could be appropriate for sharing like really timely, critical public health information. Those infographics that I shared in the earlier slides from the Department of Health are some great examples of how you can go about informing communities. The downside of the inform level is that the community isn't involved in identifying the issues that matter to them or in shaping how the results are analyzed, interpreted, or presented. Another downside of this level is that it can be hard to access community members in order to inform them. It's like we wouldn't have known about those cool infographics if we hadn't gone looking for them. So one way to enhance the way that you're providing information to communities would be to engage community partners in creating the materials and giving the presentations, or reviewing and weighing in on the way the information is presented in the fact sheets. You might also want to consider having community partners deliver the information, as information is often better received when it comes from a trusted community member, trusted messenger, rather than someone from outside the community. Okay, at the second level is consult, in which input is gathered from communities, often through focus groups, interviews, or surveys. This consultation offers valuable opportunities for incorporating community voices and perspectives into your planning and improvement of projects. However, the communities are still kind of left out of the creative process at this stage. By the time they're consulted, the research question and methods are usually already set, and researchers are just looking for input on a few select areas. So this doesn't give communities a real role in shaping the direction of the research. The third level is involve, in which community needs and resources are integrated into the process and they inform planning efforts. So this could be like an interactive workshop where community members are part of an advisory board, and they help refine research questions. They may co-create surveys or interview guides, or they may help pick which outcome measures you use. So they have more involvement. They're helping to shape the direction of the research, but it does come with challenges, because involving community members can be time consuming. And then the researchers also need to be prepared to shift direction based on community priorities, which can be difficult to do, especially if you're tied to specific deliverables and timelines by your funder. At this stage, researchers are still setting the research questions, and the community partners are likely not involved in collecting data or analyzing it. So then the fourth level is collaborate, where community members take on leadership and decision-making roles throughout the research process. This goes beyond just offering input. They might be involved at every stage. They might form advisory boards, co-design research tools, help to implement solutions, collaborate on data analysis. And they also are at this stage helping to shape the research question. So this can be really exciting, but also really challenging, again, because it can require substantial trust to get to this stage. And similar to that involved stage, it can be difficult to balance community priorities and the expectations of funders. So then at the highest level here, defer to, communities have real ownership of the process. So they identify the questions, they help to design the methods, to gather the data, to implement the interventions. They also take the lead in sharing findings back to their communities. And in this stage, researchers are more supporters or facilitators, offering expertise when needed. And this stage really recognizes the community as the expert throughout the entire process. And again, this, while it's the deepest level of community engagement, it also can be really challenging for researchers to step back and let community lead. And again, really tough depending on who the funder is, but this model can be the right one, especially, I don't know if you all are seeing in places that you're funded by, but there are increasing efforts to have like community partners be the ones receiving the grant funding. So this is where this can be really appropriate. Okay. Sorry, it's not switching on my view. And it switched. Okay, sorry, there it is. Okay. So now I've set the stage, I want to talk a little bit more explicitly about the Chair C Community Engagement Core, or CEC, and how we're incorporating community engagement into our work. So our CEC is responsible for connecting the overall work of the grant with relevant communities and vice versa. Our main goal, the main goal of our CEC, is to improve collaboration and communication between researchers and community partners. And so this means making sure that we're learning from community partners what their goals and priorities are as it relates to climate change and healthy aging, and then making sure that those goals and priorities are integrated into the work of the grant as a whole. The CEC is also responsible for making sure that the findings from the grant are shared back with community partners so that the work can reach the communities and individuals who could most benefit from the research. The CEC has three main aims. The first is to facilitate the engagement of community members and partners in multi-directional communication on issues related to extreme weather and healthy aging. And so our main activity under this aim is having quarterly community engagement panel meetings, which I'll talk about in more detail in just a few minutes. This aim also includes our engagement with any other community members or organizations doing work in this space. So under this aim, we've been having tons of meetings, connecting with tons of individuals and organizations that are doing wonderful work. And then our second aim is translating and disseminating findings from research with those most likely to be impacted and to benefit. So while aim one is about establishing and sustaining the partnerships, aim two is more of the substantive work. And then aim three is about evaluating how we're doing in aims one and two. I don't want to spend too much time talking about evaluation because I've got a lot I want to cover that is more exciting in aims one and two. And I'm happy to further connect if people are interested in talking more about evaluation. But just quickly, one of the main ways that we evaluate is having our community partners assess our progress each year using that spectrum of community engagement to ownership. We also use other established measures. Lots of them are from PCORI. They've got a lot of wonderful resources about measuring engagement. And we also gather feedback at the end of every meeting with our partners to see if the meeting was a good use of their time, what we could improve on, what they'd like to see in future meetings. And we keep a record of those responses and use the feedback to inform the decisions we make. And we also make it a point to tell the partners exactly how we use their feedback, or if we don't use their feedback, we say why. Okay, so shifting back to the partnership aspect, so aim one of the community engagement core, a primary way that we're doing that is through our community engagement panel, or CEP, that we've developed. The role of the CEP members is to identify research priorities in the communities in which they work and live, provide insights about the interpretations of research findings and implications of those findings for policy and practice, to co-develop and distribute Chair C findings and resources to relevant communities, and to evaluate our engagement and capacity building efforts. So these are the organizations that are represented on our community engagement panel. We have two subcontractors, PACE of Rhode Island and REJC, the Racial and Environmental Justice Committee, who are more involved and are responsible for co-directing community engagement priorities, co-developing resources and deliverables right along with us. We meet with them monthly, and we meet with the whole panel quarterly. The other panel members include key players in Rhode Island who provide services to older adults and or are focused on environmental health. They include Meals on Wheels of Rhode Island, Age Friendly Rhode Island, the American Lung Association in Rhode Island, Rhode Island Public Health Association, Village Common of Rhode Island, and Rhode Island's Health Equity Zones. You may have noticed I just said Rhode Island a zillion times. One thing that is really cool about these partners is that although they're all very locally focused, most of them, if not all of them, are part of larger national associations or initiatives, which we believe will be helpful as we think about sustaining and scaling the work that we're doing. I also want to say that these relationships and partnerships were not formed overnight. Many of these were existing relationships that we developed prior to this project or that our colleagues had established prior to this project, but some were formed through cold outreach to organizations that we knew are doing important work in this space. I also just want to suggest, though, that before you do any cold outreach to potential partners, I would suggest checking in with your organization's community engagement office. We have some excellent resources for that here at Brown, including Sarah, who is our liaison here in the School of Public Health. And I'll point to some more of those resources at the end. But it's really important to make sure that you have an idea of the landscape of what relationships may already exist, pitfalls that you may not be aware of before you try to do any outreach. When we were preparing this grant submission for Chair C, we connected with a whole bunch of potential partners, had numerous planning meetings where we co-developed ideas, and those ideas ultimately became what we proposed in our community engagement core for Chair C. We also know that this is not everyone that's doing excellent work in this space, even in Rhode Island. And so we do have room on our panel and are actively looking for additional players that may want to join or may be appropriate to join as we continue to get into new areas of focus. Okay, so our CEP meetings so far, we've had 3. For our first CEP meeting, we thought it was really important to focus on relationship building. So before diving into the work, we wanted to get to know each other as people, and we thought that establishing rapport and trust early on would help set the tone for the ultimately 3 years of collaboration ahead. And also, I want to back up a little bit and yes, this grant is 3 years, but it's never intended that a grant is going to be a one-off. We're seeking follow-on funding. And so we're hoping that this isn't just going to be a 3-year partnership and then, goodbye forever. So we dedicated a huge chunk of this first meeting to introductions. Ahead of time, we asked participants to think about who or what motivates them to do work related to climate change and healthy aging. And we also invited everyone to share a photo if they felt comfortable. And so then when people did their introductions, we shared their photos on the screen, and it was really moving. It really helped to humanize the work that we were doing and help us get to know each other as people, not just as people that are interested in, our own research or advocacy or service organizations' focuses. We also spent the meeting introducing the grant and talked about their and our goals for what we wanted to achieve together on this project. So on this slide, we've got a couple of photos from that first meeting, and we've also got a one-pager about the community engagement core that we drafted to help introduce ourselves to potential partners. After this first meeting, we then had individual meetings with each partner to continue to strengthen relationships and to continue to understand and catalog their specific goals, needs, and priorities for working on Chair C and around climate change and healthy aging. And we use these conversations to start to build relationship frameworks with each partner to guide the rest of our work. We then internally reviewed all of the frameworks and notes from these individual meetings with partners and identified the common themes, goals, and priorities. And we did this by creating a spreadsheet to organize all the discussion points, and we grouped together similar ideas together and used all of this to create a draft shared framework for the whole CEP based on the most frequently discussed topics for each section. So then at our second CEP meeting, we spent the majority of our time reviewing and refining that shared framework together, ensuring that the final draft was co-created by the panel and reflective of the whole group's shared values and goals. After that meeting, we formalized the living framework and sent it to all CEP members for their edits, comments, and formal approval. And as it says, it's a living framework. So we continue to revisit this document with all of our partners at our standing monthly meetings with subcontractors and at our quarterly meetings with the CEP to ensure that we're staying on track and that the living framework continues to accurately portray the CEP's priorities and needs. We also track every change that we make, and panel members sign off on these changes. You can see a section of the framework on this slide. And this section just includes the CEP's values and then big picture goals. And then you can also see where text has been stricken, and you can see where modifications are made, and they're called out with green text, and they're dated as well. All right, so then at our last CEP meeting, which was last month, we spent our time discussing the CEP's priorities around climate change and their specific research questions that they had. So to do this, we went back through our notes from our dozens of meetings that we had with CEP members and the other partners, organizations, and individuals that we'd been meeting with over the past year or so. And we pulled the needs and priorities surrounding climate change and healthy aging that were identified. And so we then took those priorities that had been identified and wrote them on the blue index cards that you can see on these sheets, and we sorted them into categories like housing, information, and planning. And we asked all the panel members to go around the room and review these priorities and categories and make note of the things that they agreed with, the things they didn't agree with, what they thought was missing. And so then the Post-its that you see on these sheets are the additions or edits that they made while they were reviewing. And so then after that time spent reviewing, we all came back to discuss, and we talked about the priorities, and we also talked about how to take these priorities and research questions back to the other cores so that they can be acted on. And then in our next CEP meeting in 2 months or so, we're continuing this conversation with them and plan to do some prioritization of the research questions and planning for next steps of how to act on. Okay, so next, I know it's cut off a little bit at the bottom, but next I'd love to share some of these priorities that our community partners identified. I'll talk through some of the background behind each one, who identified them or who is interested in working on it, and then also some potential ideas for collaborative projects. And if any of these priorities are of interest to you, I'd love it if you connect with me afterwards, because if you are Brown faculty or staff, we do have pilot project funding available from the Chair C grant, and I'll talk more about that at the end of the presentation. All right, so I'll start by talking about 2 priorities that community partners identified that we have already started working on. So this first one, it came up through discussions with our CEP members, and it's regarding improving climate emergency preparedness plans for older adults. And specifically our partners, specifically REJC, was really interested in perhaps collaborating with housing authorities to develop emergency plans and resources for older adults residing in public housing. So over the summer, we had several meetings with the Providence Housing Authority, including people that work directly with residents, with their strategy office, with their security office. It was sort of meeting with a bunch of people and sort of trying to get them all on board. And we've submitted a project proposal to them, and they've tentatively reviewed it and are now taking it to the resident leaders to get their thoughts. But throughout these meetings and that proposal, we've emphasized that we'd like our work to be fully collaborative with residents and staff. We want to be as far on the right side of that spectrum as we can, because we think that doing so will better ensure that what we develop together is something that's actually useful to them. So our initial ideas are to have listening sessions or focus groups with housing authority residents or staff, and take what we learn to co-develop some extreme weather emergency preparedness resources and informational guides for residents. These resources would include information about extreme weather, health risks, and emergency planning. And we are also thinking it could include an emergency preparedness packet that could be given to all residents when they move in. And that it would include a customizable worksheet to help people develop personalized emergency preparedness plans. And this was something that the staff at Providence Housing Authority were really excited about. They suggested this idea. And then we also proposed the idea of having floor champions who would be housing authority residents who are trained to share information and resources to help their fellow residents access support and materials related to emergency planning. And so on this slide, we've got a one-pager describing what we're hoping to do that's currently in the hands of the resident leaders. And we should be meeting with them in the next week or so to get their ideas. Okay, so here's another example that is currently in the works. So our community partners have expressed that they're interested, that older adults are really interested in research and data around climate change and health, but that accessing clear, unbiased, and accurate information can be difficult. We heard about this through meetings with the Senior Fellows Program that Leadership RI puts on. We met with the older adult participants of that program, and they all raised this idea universally. So based on this express need, one of our Community Engagement Corps co-investigators, Stephanie Friedhoff, was awarded a Chair C pilot grant for the last cycle, and her project examines the climate and health information needs of older adults in Rhode Island with a focus on extreme heat. And so she's partnering with one of our CEP partners, PACE of Rhode Island, and several other community organizations. And her project will work to ensure access to, understanding of, and responses to heat-related health information. And the hope is that results from her project will inform strategies to strengthen information resilience and protect older Rhode Islanders from heat-related health risks. Okay, so now some ideas that we haven't yet been following up on, available for interested people to look into. So one idea was something that came up in meetings with the Providence Emergency Management Agency, or PEMA. So they shared that they have a need for more heat sensors throughout Providence. They said that existing heat sensors are limited to a few areas, and they suspect that there are some neighborhoods that may be much hotter, and that having more and higher quality heat sensors would help them to better activate extreme heat responses, like opening cooling centers earlier and more proactively. And so we're thinking that this could be an exciting pilot project for an interested team. We'd be happy to help make the connection to PEMA if someone's interested. And that potential project could work with PEMA to identify locations for heat sensors, could monitor and record temperatures in those areas, could see how the data compare to those from the existing sensors, and then hopefully use findings to inform planning and heat response policy. Our partners have also mentioned this idea about primary care providers and health screenings. And the fact that, we have screenings like the PHQ-9 when we go to our PCP, and, it measures things like, risk of depression, and but we don't screen for extreme weather or climate related health impacts. One of our partners, PACE of Rhode Island, does collect data like these and then are able to follow up on helping to meet the resulting needs. So for example, with our patients who have pulmonary conditions, they're able to prescribe and provide air conditioning. And then during the summer months, they follow up to ensure that people's air conditioning is functioning. And so PACE suggested that would be a cool pilot project, like partnering with a primary care office or with a community health center to pilot a health screener that addresses questions around and concerns around extreme weather and health that can inform first more awareness of their own patient needs, but ultimately the potential to respond to those needs. We've also heard a great deal from our partners about the intersection of climate change and housing. So in Rhode Island, we have a lot of older homes, and we've also, as I mentioned earlier, got increased flooding and expanding flood zones. And so a few organizations and partners like Housing Works Rhode Island and our Health Equity Zone partners emphasize the need to improve weatherization and strategies for addressing housing-related issues caused by flooding, like mold. So a possible research project could explore strategies to develop or enhance incentives or discounts for property owners to encourage weather-resilient home improvements. Partners have also suggested cost analyses of energy efficiency and weatherization measures to support government partners, housing developers, homeowners, and landlords in decision-making. On a similar note, our partners also expressed concerns about how extreme weather is affecting housing insurance. In communities like Rhode Island, Massachusetts, other coastal communities, we know that accessing and keeping homeowners insurance is increasingly difficult. This may be especially problematic for older adults who are on fixed income. So people are, losing homeowners insurance because they're not able to afford it. And then this makes them really vulnerable during extreme weather events. So perhaps a pilot could study the relationships between homeowners insurance premiums and retention of homeowners insurance, or relationships between homeowners insurance and the ability to age in place more broadly. Relating to that previous slide, Housing Works Rhode Island has also emphasized that we need to think about ways to develop new incentives and discounts for owners to make their homes more weather resilient, especially if insurance costs continue to rise. All right, I think this is the last of the priority areas, and this is an exciting one that came up in our last meeting with our partner PACE. They mentioned that they collect a lot of wonderful health data about the participants of their program, but they'd love to be able to better leverage it. Are there data they can link it with? We have all these exciting data, but we don't know how to best make use of it, was what they expressed. And so we thought it could be beneficial for community organizations, government partners, and researchers to maybe form data work groups where they can share the kinds of data they have, talk through ideas, identify potential data linkages, offer feedback and suggestions to one another. And the thought is that perhaps this could lead to innovative projects, but also strengthen relationships with community partners. Okay, so those are just a few of the many ideas that have come up through this first year of our CEC's interactions with community partners. I'd just love to share quickly some Chair C resources that can help facilitate conducting climate and aging research. So as I mentioned, Chair C funds pilot grants to support Brown faculty or staff in preliminary studies related to this theme of climate and healthy aging. And applicants who meaningfully include community partners are also eligible for additional funding through that opportunity. So for more information, please check out the Chair C website. And I've also got the QR code up there on the screen. And if any of the ideas that I've mentioned were of particular interest, please feel free to follow up with me because I'd love to talk through them. Chair C also has a grant launcher, which is designed to help investigators at any career stage turn their ideas into grant applications. And Chair C can help connect you with relevant experts and support. Again, for more info, please see the Chair C website, or we've got the QR code here on the screen. And then we've got some upcoming Chair C deadlines and events. So letters of intent for that pilot project are due on October 27th. But that is optional, and LOI is optional. And then full submissions are due January 9th. And then we've got a few upcoming Accelerating Science Colloquium. Next is Alan Just, our research project core lead. And following that in January is Teresa Shireman, our administrative core lead for Chair C. On this page, we've got some Brown University-based community engagement resources. I know you're not able to access these right now, but we'll be sharing the links after the presentation. So please feel free to check all of those out if you are based here at Brown. And then there are also so many great resources outside of Brown. And we've got just a few links and starting points here on this slide that, again, we'll send after the presentation. And with that, I want to open it up to questions, but also thank you so much for coming today and hearing a little bit more about Chair C and the community engagement research we've been working on. Thank you so much. All right, maybe I'll stop sharing, and I see we've got some comments in the chat. All right. Sorry, just trying to catch up on the chat. Okay, good, we can see that. Okay, all right, nope, Maggie was just sharing helpful, critical information.
I think
Any
Kim
questions?
Bernard has a question.
Yes, go ahead. Hi, Kim.
Hi, good to see you again today. This is a little silly, but also maybe not. So I love that you had everyone in a room with Post-its. I love doing group processing like that. It's very pre-COVID. But I'm just wondering, like, increasingly, whenever I try to do an exercise like that, there's a desire to have it hybrid, or someone can't be there and wants to be online. And I'm just wondering if there's any best practices as far as having all of your community partners in the same space, whether everyone's on Zoom together or everyone's in the room together, and how you can kind of modify your engagement given the different modalities.
Yeah, thank you so much, Kim. And that is a wonderful question. And that's one that we've been struggling with. Earlier, I alluded to, like, we also tell partners when we're not going to move forward with their feedback. Because, like, one suggestion that someone had was like, ooh, let's have a shared Google Doc for all of us to write notes in the meeting, which I love. But I was like, ooh, if that were me, then I'd get distracted by email. And so I was like, hey, I think this is a great idea. And maybe for some of the meetings we can do that. But for this one, well, yeah, I would love it all if we can, like, try to be as present as possible. That has come up, like, everyone is super busy. Community partners have so many competing needs. We're just like a small part, often a tangential part of what their work includes. So to, like, expect them to be in person is really hard. We do pay our community engagement panel members for all their time. So that helps a little bit. But I don't know about you all. I have not found a good answer to this, because, like, I feel like when people are hybrid and others, like when people are in Zoom and some are on the room, it's so hard to, like, I feel like it's either everyone's on Zoom or no one is. I don't know. And I know Sarah, so we've got Sarah here in the room, and she's the community engagement expert for the School of Public Health. And you've got sometimes we do Zoom and sometimes we do.
I don't think it's dynamic in connecting conversation, but just given those realities of partnering for the schools advisory
functions almost like a nonprofit board. We try to alternate our quarterly meetings, so we'll do one in person and then one remote entirely. The in-person ones can be hybrid, but I find hybrid is very tricky to keep it dynamic and interesting. I would almost think one or the other is actually better. But for accessibility, we have felt like we want to offer that if we're doing an in-person meeting. So I think offering options is often the best to see what people respond to. And then sometimes it depends on the members themselves. They may find, I know I'm thinking of another group I was part of. We wanted to do in person. We had an in-person meeting. I think 3 people came and everyone canceled the day of. And the whole group was like, we had good intentions, but actually we realized Zoom is the one. So sometimes it's like testing it a little and seeing.
Sorry, we can't hear Emily.
Okay, can you hear me now?
Yeah, I think if you just want to, like, restate the audience's question, that might work better. Thank
Yeah,
you.
sorry. So I was going back to Betsy's question in the chat about, is it better to host outside of Brown? And I think that ties well into this, and I think, yes, we do intend and are planning to have our next CEP meeting outside of Brown. And I think that really helps to build buy-in from partners. We've also had meetings just like visiting each other's spaces and, like, getting tours of the facilities, and where we've all, like, been able to see what each other does. And that has just been really impactful. So yes, would also recommend that as well. Although, of course, it's always tough for us to come in and try to figure out the logistics of hosting if it's not a space we're used to.
Yeah, I have a question. My name is Daisy Winter. I'm from the Information Futures Lab, and I'm managing Information Needs of Older Adults project. But I just wanted to talk, or like ask about, like, actually in real life, how do you go about, like, engaging a partner, right? Of, like, and how to not be awkward. And then also, you know, it's interesting of like what the cart before the horse situation, where it's like you turn in, you prepare a proposal, and you've already decided your methodologies and your questions, seemingly without partners, because you either would have to meet with them before you came up with your idea, and you don't have potentially any funding to give them for their time and energy. So I just am curious to hear about your like recommendations of like, how do you actually go about doing that in a way that is not awkward and exploitative?
Switching audio back. Did everyone hear Daisy's question? And can you hear me now?
Yes, and yes.
Okay, perfect. Okay, so wonderful question and so challenging because increasingly funders are like, oh, we want you to actively include community partners in the engagement of this grant that is due in 6 weeks. And yeah, how do you actually do that? And that was something that we experienced for this Chair C grant.
Yeah.
I was brought on, I think, 8 weeks before it was due, and they were like, okay, Emily, like make a plan and engage people in making that plan. And so I was able to leverage existing relationships that I had. And fortunately, Rhode Island is like a small community in that way. And like the relationships that I didn't have, someone else on the team did have. So really like relying on your networks and who you know. That point about like, you know, we had to be really pretty vague. We had to be as vague as we could in saying what this grant would do, because the whole point of the grant was to figure out what we were going to do together. So we presented like, here are the types of, you know, like here are the activities we'll do to determine what the deliverables will be. And here are some potential deliverables that we could have. But the NIA isn't as flexible as other funders about, you know, the modification of plans and the modification of deliverables. So it was pretty vague, which was a challenge. And then your point about like, you know, paying people for their time, like, yes, fully. And that's why I think like if we can use those sorts of frameworks that like build strong relationships over time, hopefully we can like always be building up to that and like can do some of that in the end of the prior grant. We're sort of already working on the next grant. Oh, sorry, Beth, let me switch audio. Sorry.
Following up on that, the pilot proposal program is meant to help with that cart before the horse program. And so if you send in an LOI and you say, I'm looking for a community partner, we have these relationships with the community partners that Emily showed. And so they're already engaged, they're already being paid, and you can, we're playing matchmaker. That's awesome. To help with that. But I have a question that I'm thinking about. If I were applying for a pilot project, how would I plan to, like, what would I want to include in my budget for a community partner to do community engagement? And I'm particularly thinking about a PI who may not have a lot of experience with community engaged research. And so maybe they would want to budget for a community engagement specialist who could advise them. Is that something that, you know, so would we have, say, graduate students who have some training in this, or some sort of connections to research staff?
Sorry, switching audio again. Did everyone hear Beth's question and can hear me now?
Yes, and yes.
Okay, perfect. So that is an excellent question about, you know, having, so two questions I heard, sort of how to think about developing a budget for community, for your community engagement work. If it's one of these pilots or, you know, even if it's outside these projects, I'm, you know, not an expert in budget development, but I'd be happy to be like a starting point to like sound ideas, you know, like work through some ideas with people. I would also suggest, you know, talking to the community partner that you intend to work with about like, what are you thinking your role would look like? How, you know, thinking through it, like how much, like what % effort would that entail, and sort of building it through together. if it is one of these pilots, you know, we've got our community engagement project manager, Eliza, who is in the room here with us, who is funded on the community engagement core. And we haven't talked about this, but I imagine that would be within Eliza's scope to be able to assist on projects as needed. Happy to talk that through if there's a specific person with a question. And then I see we've got a couple. Okay, so Betsy, you had a comment, key connect with Brown Research Ops before promising funding. Do you want to say any more about that, Betsy?
Sure. I'm just in response to Daisy's comment. I think that sometimes it can be frustrating for folks to get funding out of Brown and to their community partners. And it is something that we know about centrally, and we're working on streamlining this. But there are some pathways that already exist, and sometimes they're available, but they're just behind some keyword. And if the person who's, you know, administering the budget doesn't understand what's happening, they might say, no, you can't distribute your funding that way. But actually with a different, you know, framing, and by communicating with the research staff, you can figure out a way to do it. So I've been trying to advise folks that as you're developing a proposal, talk with, you know, your administrators and say, how might this work, before you make any promises to your community partners or to your funder.
That is a wonderful point, Betsy. Yes. And I know there are a lot of efforts to try to smooth over those processes that are still being worked through. Yes. All right. And then I see there's a question from Adrian. Adrian, I don't know if you want to ask it yourself or I can just start reading it. How do you continue to keep community partners engaged through the process? I encounter where one or two stay engaged and are enthusiastic, but others may not be as engaged as time goes on, especially with schedules and limited capacity. Great question. So we're only just starting year 2 of this project. Unfortunately, have not had to encounter that. I think regular check-ins, like I know that seems like an obvious answer, but like regular check-ins to ensure that like what they're like to ensure that their role on this project is still consistent with like that their role in this project is meeting their needs, meeting their goals. Ensuring that we're achieving what we're setting out to achieve with them. I know receiving that kind of feedback that like, actually, you're not doing what I want you to do and we're not getting this out of it can be tough for us to hear. But I think having those tough conversations can help to promote more meaningful connection overall. I don't know if that was a great answer, but I don't know that there is a great answer. All right, so it looks like we're at 4 o'clock, but if anyone has any additional questions or you want to talk through research ideas, please contact me. And I believe Maggie is sending out like a follow-up survey, but Maggie, I'll also make sure that you get a list of all of the resources that I am hoping to share after the presentation as well. So thank you so much.
Thanks.